Welcome to this video discussing mailroom safety. The purpose of this training is to educate staff on the threats posed by suspicious packages, a few mitigation strategies, and evacuation procedures. We will be covering the 4 main objectives that you will need to implement if a mailroom incident occurs. While handling the mail, it is critical to remain alert and be mindful of any out-of-place details. Do not let yourself be complacent, as this may allow items to slide past. Is there a return address? Does the envelope feel overly bulky or containing protruding wires? Is it badly written, typed, or misspelled? Is there an unknown powder? These are just a few of the details that should alert you immediately. What are the required next steps if you discover something suspicious? Do not handle, move, or shake the package. Do not sniff, touch, or taste any contents which may have spilled. Do not carry the letter or package or allow others to examine it. The first thing that must be done is to place the item down gently. When creating a secure area, ensure that no one leaves who was present when the item arrived, and no new employees enter the area.
If you suspect an explosive or mechanical device may be in the package or letter, do not use a cell phone near them.
Walk as far away as possible or attempt to communicate via a landline or email. Many potential explosives can be set off by cell phones. When the area is secure, immediately begin informing your managers and the police. Call, text, email, use any form of digital, non-face-to-face communication to ensure that the people who need to know are updated on the current situation. Once you've informed the authorities, you must let the other employees in your apartment know what has happened. Again, it is extremely important that you do not use face-to-face communication. Do not write a note and slide it under the door, as other materials may now have been contaminated. Do not crack the door open to talk to someone. Everything must be done digitally to eliminate additional exposure.
Leave the suspicious package or letter where you gently placed it. Do not get a closer look for any reason.
If you have the ability to do so, close all HVAC systems and vents to prevent any airborne substances from traveling to additional rooms or floors. Document all persons who were present when the exposure occurred to help first responders. If the exposure occurred in the break room, any staff involved should wash their hands. If not, do not leave the secured room. First responders will assist when they arrive. While this is a scary moment, do your best to remain calm. Fear and panic will only worsen the situation. If you are outside the exposed area, do your best to keep your management informed of the situation, as well as relaying information to those inside. Let the staff in the exposed area know via phone, text, email that first responders have been notified. Evacuate the building following evacuation protocols. Remain at the evacuation site until first responders have spoken and given the okay to release your organization. Follow the directions given by your management. Depending on the situation and analysis of first responders, you may be released to return to your workstation or sent home to work remotely while the building is decontaminated. What happens after the event? Any staff who are exposed will be monitored by first responders. Some may be asked to go to the hospital for further testing. Wait for first responders to release working staff by giving the all clear for both inside and outside the building. Depending on the type of exposure will determine the steps EMS Hazmat will need to take. Follow management's directions on moving work operations to an alternate location for remote work setups. If you remember nothing else, remember these 4 items. Stay calm, notify, follow directions, and be prepared. Stay calm and minimize contact with suspicious packages or contents. Notify staff, security, responders, and others in the building. Follow the direction of the first responders. Be prepared to follow work protocols from your continuity plan.